word and I caught up on that. You said metabolism. Bones also have metabolism, doctor?
Yeah, it's a living tissue. So any living tissue in the body, the skin, the liver, your organs, everything will have its own metabolism. Similarly, the bone metabolism is also there. There are some.
So that depletes by premenopausal or during the menopausal.
So it's like the framework of bone is mainly formed by some calcium cartilage, this kind of material. So the deposition of new bone is usually much better with that estrogen hormone. So it is regularly needed for the growth and the maintenance of the bone structure. So if it gets depleting, the osteoblastic activity starts less, and osteoclastic, where the bone cell destruction will start occurring.
Okay. So that means during the menopause, actually, when we are not making the estrogen, that is the time the depletion of the bone starts, but not in the premenopausal time.
Yeah, the premenopausal are as equal as the men. The premenopausal, you need not worry. Usually, the whatever bone metabolism with estrogen is happening, it has got a good mineral density. But during menopause, you could lose almost more than 20% of your bone mineral.
Okay.
So the density starts getting less. So that is the severity which happens so suddenly within 3 to 5 years, so that the woman health start getting deteriorated, especially the bone things are concerned.
Okay. So is it good to have a bone density test done by during the menopause time or before? Is it necessary for us to do the test? Because I have not done up till now. And when I was reading about bone health, and I came across this bone density test, and I was wondering how important that is.
So before that, we need to understand what is osteoporosis. Osteoporosis means the porous bones. That means there is some density which is there in the bone, which starts depleting. Means your bone starts getting brittle. If you understand, it is a honey cobweb kind of thing which is there, which could having more honeybees and more honey dense structure. It starts getting loose. So that is why these are the porous bones. That means the bone mineral density starts getting less.
Okay.
So for diagnosis of osteoporosis, so there are various indications where you can go for this bone mineral density. So for diagnosis, there is certainly called the DEXA scan or the bone mineral density scan. So what it does, it's kind of X-ray only. You can see it's a dual absorption X-ray absorptiometry. So what does this machine do? It's like it takes X-rays of your lower spine or the hip region. So when the earliest sign for your bone demineralization start occurring, means if you do your bone scan or your body scan, the most of the bone will start getting depleted in the lower back and the hip region. So that's why you also know that the more fractures are very common in females after menopause are on the spinal fracture or the hip fractures.
Okay.
And the third common are the wrist fractures. So what is this BMD or the bone mineral density is like? There are two things. There are two scores which we see if you do this test. We have to compare, like just for example, if you do your bone scan, you need to compare it with something. There are two scores like T score. You need to compare your bone with whatever is usually what could be at the younger age at 20 years and what is there at around 45 or 50 years. So that is one comparison. And another comparison is with you, with the another of the lady with the similar age. So these two comparisons are usually taken with various scores with that BMD test. And then we can certainly quantify whether you are having this osteoporosis or not. The scores are negative, that means you do have an osteoporosis.
Yeah, that means most of us have not done a bone density test. That means we can't compare with our younger self, right?
Yeah.
So only way is when you see a healthier bone in another woman, only I think that comparison could be easily done. Because if I want to go and do my bone density test, I'm going to do it only for the first time now, isn't it?
Yeah. These are usually compared with a standard which should have at that age.
At that age.
At
Okay.
that age.
So are you recommending to do this bone density test at a certain age for every woman? Like if you're 40, you should do it, or, you know, if you're 45, you should do it, even if you're in premenopausal time?
So that's a good, important question. It's like if you want to diagnose osteoporosis, should we get it done like even as a screening protocol, like for heart, we do the echo, angiography, such kind of thing.
Yeah.
So what is usually recommended at before menopause, you don't need it.
Okay.
Only if you do have some other associated problems, like if you are with some surgery, your ovaries has been, the patient's ovaries has been taken out. The patient is having some other elements like the hypothyroidism, or there are various, the lady is on certain medications like the steroids, or these usually depletes your bone. So there are if there are no other medical comorbidities, you are not on particular medical condition. So premenopausal, you don't need it. Usually,
Okay.
usually during menopause, there will be certainly the things will start deteriorating. Even during those phases, if the patient doesn't have got any symptom, if there are no problems, so usually we consider that the patient will have some kind of osteoporosis that we already know, and we don't need to quantify it if there is no problems. But certainly, it has got most important role in the post-menopausal period.
Okay.
So that is the time when if you really wanted to see your bone health, you should go for that bone BMD test, and then periodically you can assess whether that is improving or decreasing, and accordingly then you can take the advice and the treatment if needed, depending on the scores.
Okay. You said BMD test?
Yeah, it's a bone mineral density test.
Okay. Devi, if I can request you to put it on the chat box for the audience to make a note of the test that the doctor is recommending. You also said that if there is, so in hormonal therapy for women during menopause, you know, there is a therapy, some of us go for it. Does that have a direct connection with degrading of your bone, degradation of your bone density? Because you just said that any medication for certain medication with thyroid, or, you know, even for hormonal, we do take, right? Some of us do take if we can't bear the symptoms.
Yeah, see the thyroid diseases are one of the important, like these are the usually problems which simultaneously along with osteoporosis most of the women have. So if you consider the incidence of osteoporosis, so it's like almost half of the population above after menopause will have some kind of osteoporosis, and they could even experience a fracture because of that osteoporosis. So such is the gravity of this osteoporosis, especially in the woman after post-menopausal time. So, and the males, it is comparatively less. Only 20% will have that kind of osteoporosis.
Okay.
And
so for female, it is much more.
Much more, yeah. It's almost 50% will have some kind of fractures. That is what I'm trying to tell. During her lifetime, from post-menopausal onward towards the fag end of the life, she could experience one of the fracture. At least one of the two females will experience that fracture because of the osteoporosis, which is less common in males.
Okay, that's a big number.
That's a big number.
Little bit frightening also at the moment. So there is, you think there is a link between thyroid disease and osteoporosis?
Yeah, absolutely.
Because you said thyroid, and I'm catching up on that word. That's why I'm asking.
Yeah, absolutely, absolutely.
I have thyroid,
hypothyroid.
So
that's what I was coming up to, like the osteoporosis and thyroid. These are two more commonest conditions simultaneously existing in females. Taking a long-term therapy with these thyroid hormones, the hypothyroidism. So again, as I already told you, apart from the estrogen hormone, these thyroid hormones again play a very important role in the bone metabolism. They help in the calcium and this vitamin D3, this bone mineralization. So those hormones are very essential.
Yeah. So if you take, if you are having thyroid, is there also vitamin D deficiency is shown, and that is directly linked to osteoporosis?
So again, the vitamin D3 is a different entity. Thyroid hormones is different entity. Both are important for bone metabolism, for new bone to form and
Okay.
density to have. So
Okay.
independently, both are very essential. Vitamin D3 is very essential for absorption of calcium into the body.
Okay.
And
That is why
thyroid,
it is essential.
yeah. That's why we always recommended to have these D3 supplements always.
Yeah. So does the D3 supplement that we orally have, does that help, or it should come through food? Because a lot of doctors seems to be thinking that anything orally is added doesn't get completely dissolved in our body. Is that true, doctor?
It's like nowadays these capsules, even these liquids, these have come up certainly. You certainly that daily, either you can take these vitamin D3 doses daily. What I usually recommend is to have a good sun exposure. All your vitamin D3 is produced in the skin. So what usually I recommend, it's not like usually around 2 days in a week, you should have at least an half hour of sun bath. And that too with exposed skin on the extremities at least. Other if you cover the take, and even the sun is you should be usually around from the 8 or 9 a.m. It's not a mild sun. It has to be a like we are staying near.
Little stronger.
It has to be a stronger sun. So that is main source of your vitamin D3, and the other part is certainly these oral supplements which we give, like the weekly tablets where you would go for the 60,000 doses, or a daily tablet with 1,000 doses are certainly highly recommended, especially with the other pre-existing disease and the perimenopausal females as well.
Okay. Is that the cause also then for developing back pains and shoulder pains for women, especially because these vitamins are depleted in our body?
Okay, so that's a third thing which are coming into. It's like there are like osteoporosis, your change in bone mineral density.
Okay.
The other are the thyroid diseases, and third are like the arthritis kind of thing. What we call these are the rheumatoid arthritis or arthritis, where you will have a multiple joint pains.
Okay.
Okay, so this arthritis is another symptom which usually happens in female, especially in the younger age group as well, the rheumatoid arthritis. So this is the third most common thing simultaneously for the bone problems to happen. Again, this is a totally different entity, arthritis, where the bones and the joints, they start getting degenerated because of the inflammation. Osteoporosis is structural problem with the female, which is usually natural, which sometimes we cannot call it as a disease.
Okay.
Just a kind of manifestation all the females or even the males would have. It's like the degenerative thing which happens in our joints, which happens in our body. The similar cataract which is happening in your eyes. It's similar to osteoporosis. Will be there at certain point of time. The only we need to quantify, and whether it is more or not, that only we need to see.
So then my next question is it preventable osteoporosis if we take care before the menopause, or is it manageable? Are we supposed to manage it, or are we supposed to prevent it? Because for people like who have crossed the menopause age, I think now we have only the choice of managing. But a lot of my younger friends would like to know, is it possible to prevent it in some way?
So absolutely, that's an important part which we need to understand. See, the menopause is bound to happen to every female. You cannot prevent it. It's not like it's a disease which is curable.
Yes.
with all these things, if you follow a few principles, then certainly it could be like we could modify the progression of it.
Okay.
So it all depends on how much bone mass you have accumulated before menopause, which is very important. See, our main growth occurs during when you are a child from 9 years to 18 years, when the bone health is most important. So whatever calcium or the vitamin D3, these supplements which you have taken during those years is very important for the skeleton to have. And from that younger age to the premenopausal age, so how you have kept your body in all the senses, like have you taken the proper nutritional supplements which are recommended for calcium or vitamin D3?
Okay.
The other important, how active you are. If you are a lazy person, if you are not doing any activities, what we call it as a disuse osteoporosis. Suppose if there is some injury, you have plastered it, you haven't mobilized it for a long time, so automatically this thing will get into the osteoporosis. Means if this is
Okay.
not using now, if you are not, it's like some movements are happening, some joint function are happening. So these will cause the bone to have a good metabolism. If you are not
Okay.
using it, you are not exercising it, the bone will start getting disease or osteoporosis. So the first is diet. Second is your activity level. Third are your habits. As you know, let's say the smoking is like one of the very important factor for osteoporosis, like for so many other things. Then your
Okay.
drinking habits, alcohol is another important culprit. It should be
Okay.
within a tolerable lesser limit. And the further are your weight, obesity.